Today, we will perform a routine checkup of a dual-lead microport ICD. We have already tested the leads, which is similar as shown in the pacemaker video. On this screen, we see some administrative information on the atrial and ventricular leads and about the patient. We will now proceed to the analysis of the overview screen, which holds 4 sections. The system status section, which reveals the predicted battery life of the ICD, a section about the leads, which shows the latest lead tests. We'll repeat that these tests were already performed prior to the making of this video. A section which shows the programmed parameters, in short the bradycardia settings, but in more detail the tachycardia settings. And a final section showing the statistics, with the percentage of sensing and pacing, the time passed in mode switch, meaning the time in atrial arrhythmia, then in the table below, the amount of ventricular arrhythmia episodes. With on one side the diagnostics, and on the other side the therapies. We notice a warning message, which tells us that the patient had an episode of AF which was longer than 30 minutes. But the episode was in 2019, while we are currently in 2021. Once we have performed the analysis, we can conclude that the remaining battery life will be between 5 and 7 years. We see the associated voltages here. The atrial and ventricular sensing values are satisfactory. The same for the thresholds and impedances. And here we see the RV coil continuity, which is between the normal limits of 200 and 2000 ohms. Concerning the programming of the bradycardia settings, we notice a lower rate of 65 beats per minute and a maximal tracking rate of 140, which is also the lowest value in the ventricular tachycardia detection zone. In microport devices, we can even program maximal tracking rates above the slowest VT detection zone. See here how there is an overlap between the maximal pacing rate and the slowest VT zone. This is only possible in microport and biotronic devices. I will just reprogram it to 140. Now we can easily conclude that there have been no VT, VF or other type of episodes. We do notice a large amount of other episodes after 2 years of follow-up.